registered psychologist. I work in Bondi Junction in New South Wales, Australia. I've been working in the field of addiction for around 6 years, both inpatient, outpatient, private and non-for-profit sectors. The clients that I tend to see that are coming with addiction concerns typically present with other mental health concerns as well. That can range from anxiety, depression, or stress within the workplace. Quite often people are falling, I suppose, victim to the culture of the industry that they're in, or perhaps this could stem from, a historical concern around substance abuse within their family or their environment. But yeah, predominantly the mental health concerns that I see are definitely related to stress and anxiety or depression. The concern with diagnosing these mental health concerns when there are substances involved in the person's presentation is you're not sure whether you're seeing an actual mental health concern or whether it is as a result of the either the come down or the intoxication of a substance. So it can be really tricky to do for medical professionals or psychiatrists to diagnose off one initial session. So it is really important to have a really broad history for the client, and understanding that rapport is really important as well. The more rapport you have, the more likely it is that someone's going to tell you the truth if they're using something. So it is really important to kind of have that time and space to get to know the person over a few sessions before any diagnosis is made. In my work, I tend to focus mostly on working around the substance use concerns first, and then looking at how to manage the mental health concerns for that reason. So some of the things that can impact on someone's stress is definitely the workplace culture. If we have a culture that is not open to having those conversations around, I suppose, outside of Are You OK Day, it's really important to start to bring that into light, because prevention is really much better than any type of cure that we could possibly bring to the table. So having a culture within the organisation of truly caring about the welfare and work-life balance of each person within the organisation, both from people who are doing some great work on the ground all the way up to the top line executives. It's really important to really be focusing on work-life balance. And I suppose that brings into the mix that there can be some things that are going on in people's personal life that does sort of feed into how their stress is managed at work as well. And it is really important that within the work environment that those conversations can be had too. I suppose the EAP service is a really great way of handling that as well in a short-term solution. EAP services usually provide a sort of short-term care, usually over the phone. It can be also face-to-face. One of the limitations of the EAP services is the amount of sessions that are available to each person within the organisation is already predetermined by the organisation usually. So what that means is you may have already built rapport with the person that you're working with, and you're just starting to get a roll on, and the progress is happening, and then it's cut off. So you need to build rapport with someone new, whether you're going to seek out your own support or perhaps a different phone service. So it is really great, an EAP service, as that sort of short-term kind of crisis management sort of space, and even for something that's a bit of a simpler issue that can be resolved within that time frame. However, there are some times where perhaps with bereavement, or whether there's perhaps some workplace bullying or other kind of stress management concerns, that's where a longer amount of sessions can be really beneficial.